Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please note that Dr. Ahmed is out today. To start, I will share the most current case counts. There are 120,844 confirmed cases of COVID-19 in Canada and 40,289 cases in Ontario. Chatham-Kent has 337 cases, and Sarnia-Lambton has reported 327 cases. Michigan now has 89,271 cases, with 13,041 cases being in Detroit. Today, we are reporting 2,410 cases of COVID-19 in our community, an increase of 8 cases from yesterday. 4 work in the agriculture farm sector, 3 are in the community, and 1 is currently being investigated. 108 of our cases are currently active and are being followed by our health unit. 2,231 people have now resolved, 94 people are self-isolating, and 7 people are in hospital. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 3 retirement homes are currently experiencing a COVID outbreak. In addition, there are 6 workplace outbreaks, 4 are in the agriculture sector, and 2 are in the manufacturing sector. The ongoing COVID-19 pandemic has created numerous challenges for Windsor-Essex County's economy as many businesses and workplaces look to resume or continue their operations without compromising the health and safety of their employees, staff, volunteers, and customers. Recognizing the importance of businesses and workplaces to the community, the Windsor-Essex County Health Unit has been in regular communication with representatives and leadership from the local chambers of commerce and BIAs to identify the needs of our business communities to support their reopening efforts. These discussions have informed the development of our COVID-19 workplace website, a one-stop hub for a variety of resources such as a toolkit, checklist, guidance documents, and signage, to help businesses and workplaces prioritize public health and safety as the province reopens. The Safe Return to Business, a public health toolkit for the Windsor-Essex community, is available in both English and French, provides a variety of best practices and public health recommendations to prevent the spread of COVID-19. The website also contains Safe Return to Business checklists developed by the Health Unit in collaboration with the Windsor-Essex Regional Chamber of Commerce. These checklists are reviewed regularly and updated when restrictions or best practices are changed. The Health Unit has also created a variety of downloadable signs that can be printed and displayed throughout businesses and workplaces to communicate public health requirements such as physical distancing, maximum occupancy limits, mask wearing requirements, hand hygiene practices. These downloadable signs are available in other languages including French, Arabic, and Spanish, and can be downloadable from our resources and signage page. There's also a limited quantity of stand here floor stickers and do not enter if sick window clings available in English for order from our health unit. To order these signs for your businesses or workplace, please visit wechu.org. Another sign we have. This sign will be going into be given to municipalities and recreational organizations, and can be downloadable on our website as well. So you can visit our wechu.org, scroll to Workplaces button, and this will bring you directly to our general recommendations for businesses and workplace web page. Beneath the table of contents, there's a button called Business Reopening Signage Order Form. This button will be displayed on all the workplace subpages, and when clicked, will redirect you to our designated page where you may complete your request to order the available signage. Key changes to Stage 3, the following are permitted to reopen or resume operations in Stage 3. Includes services that tend to a customer's face are now permitted, such as eyebrow waxing or beard trimming, movie theaters, gym and fitness studios, indoor events with a maximum gathering of 50 people, outdoor events with a maximum gathering of 100 people, real estate open houses, sporting and racing events. Libraries may reopen for all on-site services. The following must continue to remain closed in stage 3: amusement parks and water parks, table games at casinos and charitable gaming establishments, buffet-style food services, dancing at restaurants and bars other than performers hired by the establishment following specific requirements, overnight stays at camps for children, private karaoke rooms, prolonged or deliberate contact while playing sports, saunas, steam rooms, bathhouses, and oxygen bars. Please continue to visit our website at wichu.org for current COVID information. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from Windsorite?
Good morning. I was just wondering, so two local municipalities, Windsor and Leamington, have now implemented orders or bylaws related to masks at establishments that the health unit has not included in their order. Is the health unit planning on upgrading their mask order to include some of these things so that it's not such a fractured, I guess, approach across the region?
Well, municipalities have the ability to enforce expanded mask requirements through their bylaw officers and enforcement officers. And so it is quite common for the municipality to have an added measure for public places or municipal places. So that is what the city has done and other municipalities in our area, which is quite good. We do not plan to incorporate those changes into the overall class order for masking at this time.
Thank you.
Any questions from CBC?
Not today, thank you. Places or municipal places. So
any questions from AM 800?
Teresa, with us going to stage 3 yesterday, any
plan to
additional calls for enforcement?
So I believe you asked if going to stage 3 if we had additional calls. Our calls continue to come in about the patios, and we do continue to get compliance questions and complaints about the use of masks. So with some of the changes with municipalities and the bylaws enforcement, that will probably continue to be enforced through education. But the biggest topics continue to be restaurants, and it was patios up until yesterday. I don't know if yesterday brought in any new indoor issues, but we'll keep monitoring that.
I guess a spin-off to Windsorite's question, when it comes to the mask, will this help out your team a bit? Because now, if I am understanding it correctly, Leamington, Lakeshore, and the cities, their, I guess, officials or officers can issue fines, warnings, whatever. Will this help out your team a bit?
The added enforcement or assistance with bylaw and other enforcement agencies will definitely help out all of us in the community as well. So it'll help enforce the public health measures, the masks to protect ourselves and others. So of course, everyone providing the education and monitoring this will help the whole community as we reopen and as more and more people are attending other establishments and going out into public places.
Right now it's Windsor, Leamington, and Lakeshore.
Yeah.
Are you hoping the rest of the municipalities in Windsor-Essex jump on board with their own mandatory mask bylaws?
Well, they may. We have weekly discussions with the CAOs of the municipalities, and they are very clear about what our order includes and where there are some, there's an ability to expand that order from the municipal lens. So I think that we may see more, but the 3 that have brought forward the masking policy, that's quite good.
Thank you. Sorry, I had another question there. That's it for me today. Thank you.
Any questions from Blackburn?
Yes, I had this question yesterday from a listener concerned about after-school programs in schools. I guess some programs take place in classrooms, they share that space, and the concern was about cleaning between class and daycare time. I wanted to ask you on their behalf if there is anything in the rules about cleaning where you would clean between the classroom and, between class time and daycare time.
I don't know the answer to that specific question about the shared space, but there are very clear guidelines about disinfection and cleaning practices. And we have, supported the schools and had many conversations about the cleaning and disinfection and the enhanced measures for this. So the schools do have a very good handle on what is required. They have their occupational health and safety. They, have people that are very much informed and educated about the cleaning and disinfection. So that might be something in the particular, if it's a particular concern, that they could, get that clarified with the actual after-school program or the school. But all of those practices are in place. The cleaning is very much part of their routine and part of the prevention of spread of COVID. So that is a measure that needs to be in place and will be.
Thank you. The other question I had was about the toolkit for business. Have you had a lot of uptake for those stickers? Like, I'm just trying to get a handle on, are you prepared for a rush on them as more businesses open?
We just talked about that this morning because in person they're really, really nice, and so right now they're free to businesses, and they are, that you will be able to order them if you're an establishment where you think this would be helpful. And we hope people do, but if the if the influx of requests gets too much, we'll have to look at that. But the information is very good, and we hope that people will access that. The website and all of the resources are just now being posted. The ability to order online is just all brand new. We'll be sending out a media release specifically about this today, and people will be able to access this. So with the media's help, we'll be able to get the word out that these are available, and it will be public health messaging. It'll be very useful for people that otherwise would not have access to this or would want to be creating something similar on their own. They don't have to.
Thank you very much.
Any questions from Windsor Star?
Good morning, Teresa. Just wondering, we asked this yesterday, might have more information today. Is Dr. Ahmed or yourself or any representative from the health unit meeting with the Premier while he's visiting today?
No, we're not.
Okay, thank you. That's everything.
Any questions from CTV?
No, thank you, we're good.
Any further questions from Windsorite?
Just a follow-up to my earlier question. In Leamington, their mandatory masks do not apply to certain things such as churches or places of worship. But in Windsor, you do need to wear a mask at churches and places of worship. Is the health unit providing, any oversight into helping the municipalities sort of get on the same page with the restrictions? Because I can imagine it would be a bit confusing for people as to which cities and municipalities have different rules.
So, and I am aware that in the Leamington bylaw, the places of worship are exempt, and they're included in the Windsor bylaw. So the municipalities have the ability to make the bylaw, meet the needs of their community. And as long as they're communicating it and people are aware of it, that attend, or where the exemptions are or where they're not, is probably the best they can do is through education. But they do have the ability, as all of the municipalities have the ability, to develop their own bylaws and to meet the needs of their communities. And that's what it looks like they've done.
Okay, thank you.
Any further questions from CBC?
No, thank you.
AM 800?
No, thanks.
Blackburn?
I'm good, thank you.
Windsor Star?
No, thank you.
CTV?
They do.
No, thank you.
Okay, thank you, everyone.